Great.
All right. Hi, everyone, and welcome to the DPAC Brown Bag Series. My name is Erin Callahan. I'm the Chief Operating Officer of the Diabetes Patient Advocacy Coalition and also the Diabetes Leadership Council. Our two organizations work together to advocate on behalf of people with diabetes in state and federal legislature, and you've got us here today for the Brown Bag session on mental health and diabetes. We have a couple of very special guests with us today, and May is Mental Health Month, so we have brought one of our board members, Paul Madden, who's going to introduce himself shortly, and also Buster Lackey from NAMI Arkansas, one of our wonderful partner organizations. Thanks, Jacob, for those. Just a little bit about DPAC and DLC is our mission, of course, to ensure quality of and access to care, medications, and devices for patients living with diabetes, and to educate, inspire, and empower patient advocates as well as lawmakers toward meaningful action on diabetes. And when we talk about the introductions of these fine gentlemen that are with us today, we're going to share some of the success that we've had together. So first of all, we welcome Paul Madden, who is one of our board members. Paul, please introduce yourself and maybe one quick advocacy win that you've seen in your lifetime.
Okay, that's great. Thanks, Erin. I'm absolutely honored to be here. Let me give just a small look at my background. I think maybe it's helpful to know that I happen to be living with type 1 diabetes for 61 years now. I've been very successful because of the incredible supports I've had from family, from friends, and from medical teams. And I never forget that. And I hope I can pass along as much of that as I can. I think some of the biggest wins that we saw, early wins in my career, were associated with getting reimbursement for diabetes education and getting reimbursement for glucose monitoring strips. I know for many of you, that's a long time ago. It's about 20 years ago now, but those were some of the early wins. And now we're very focused on getting things like the price of insulin to come down dramatically into a reasonable amount again, which we've already won the battle in Medicare. And now we're looking to do this with everyone else. Thanks.
Great. Well, thanks, Paul. You're absolutely right. And the topic of insulin affordability is certainly hot right now. You can follow all of our social media channels on DPAC. Certainly check it out on Twitter. We live tweeted yesterday's Senate hearing that was discussing insulin pricing. So we welcome you to follow us anywhere you can. We love talking about things like that. And Paul, I like that you mentioned that you've been a part of the diabetes community for a long time. Community is so important. And another member of our community is here with us today, Buster Lackey. You are joining us from NAMI Arkansas. Tell us a little bit about yourself and the work that NAMI does.
So I'm Dr. Buster Lackey, and I'm actually the executive director for NAMI Arkansas. And we cover the whole state of Arkansas, doing advocacy, support, and education. Our warm line, our toll-free warm line, provides over 400 referrals a month for people calling in for services or just information in general. I'm fortunate to be married to a physical therapist that works with a lot of patients that have pain, and a lot of the pain is coming from their diabetes diagnosis. So I see this in my office a lot, that we have patients that come in pain, but they're also suffering from depression and anxiety that sometimes might have been overmissed by their primary care physician in their diagnosis or diagnosing their diabetes. So I'm fortunate that I totally understand this cause greatly. So
excellent. Buster, well, we're going to start with you then on that subject. You mentioned a little bit about the psychological, certainly that's in your work as a clinician, and the physical toll that I'm certain your wife sees every day that you shared with us. How does that weigh into the high prevalence of depression and anxiety among people living with diabetes?
Well, a lot of times people, they don't understand when they go to the doctor that this is part of diabetes, that they can have depression and anxiety. And sometimes I think they get labeled as a difficult patient, or someone that's the doctor, the MD kind of maybe puts off because they're always calling in or they're coming in. So they get this title, they're difficult. They're not being difficult. They're mislabeled actually, because what they're having is depression or anxiety. or some other mental health or a combination of mental health, problems. And I know that a lot of times I see patients and they say, well, we went to the ER last night and they said I was having a panic attack, but they thought they was having diabetic problems.
Oh, I see.
And yeah, so I think sometimes we mislabel them,
Yeah.
because we're quick to judge, and we're quick to go, well, no, that's depression, or no, that's not that, or that's this. And I think we just got to slow down.
Yeah.
That's a great point, Buster. Paul, I know I see you nodding your head and agreeing with everything Buster's saying. Can you share your experience and your perspective on that?
Yeah, and I guess so. I will personalize it a little bit with my thousands of friends who happen to have diabetes, but also as a mental health specialist for the last 49 years too. Much of that time at the Joslin Clinic in Boston. And there's no question, when people say I'm so bummed out, or I'm angry about my diabetes, I'm disappointed. My response early on is, how could you not be? It's not something you wanted to have. It's not your fault. And there's too many moral judgments when people say, oh, you shouldn't have got this. If you weren't so lazy, for the type 2 diabetes especially, oh, it's your fault you got overweight. Well, I'm sorry, but about 65% of us US Americans are probably not ideal body weight. So it's a normal thing. Let's not get after people for being normal. Okay, that's what I say to people. Now, but let's learn how to work with it effectively, and know that to live well with diabetes, you've got to build your spirit as a champion, because you do face things that others won't understand, confusion out there, even among some medical professionals who we adore, but they don't know it all either. And I'm thrilled that Buster mentioned that, because that is all too often happens. And sometimes the diagnosis is not so easy for even the best of medical people to come up with. So it really is something that depression, anxiety is a normal part, and it's a normal part that we have to learn to live with and get appropriate supports around us. Maybe it's our medical team. For me, it's often been my sister. My sister and I grew up to become also best friends. And she has such insights as to, is your blood sugar a little low right now, or something like that, she'll say. Or she sometimes will just even say, gee, would you like anything sweet to drink? And she knows I normally won't touch things that are sweet to drink unless I'm low. She has a gentle way of doing it. So I always suggest to people, find who are your 1, 2, or 3 main support people, and also look to recruit a superb medical team that you are comfortable with and can rely on, and they allow you to give them a call, and it's not bothering them. That's their jobs, to respond to what your needs are.
Yeah, Paul, we should all be so lucky. I love that you shared that you're such good friends with your sister. I was actually talking with my sister this morning, and I've lived with type 1 diabetes for 36 years myself. And she said, Sissy, I didn't even know that diabetes was really that big of a deal until I was in my 20s, because you always made it look so easy and seem so easy. And she mentioned that she finally recognized that there are a lot of decisions that go into every second of every day for people living with diabetes, and that this was not our choice. I love that you both mentioned that. There's a lot of talk about stigma in both the diabetes community and also in the mental health community as individual conditions. And Buster, can you speak to what you've seen through your own life, your clinical practice, what you're able to share with us, of course, and the course of your careers, what maybe has changed regarding these stigmas, or what you see on the horizon?
Yeah, so I think it was the CDC that put out a report a while back that said 2 to 3 times more people with diabetes have depression or some other mental health. I had to get that straight in my head for a second, but yeah, 2 to 3 times more. And when you talk about stigma, what we're talking about is really, I think people become uncomfortable, and we don't know how to respond. We don't know how to react. So we make these off we have titles and little things that we say, or little comments that we make. And really what that's doing, you're really hurting people when you say these things. For several years, I've always joked. I said I really need to get like a green cape and wear it around so I can, go around and just be a crusader for, in the stigma, because it's in the workplace, it's in the schools, it's in our homes, it's in our families, and a lot of times people, they say, "Oh, I've just got this dark sense of humor, so I don't mean anything by it." Well, words hurt worst of all.
They do.
You can slap me across the face and I'll remember that pain for as long as your hand's on my face. But 30 years from now, I'll remember exactly what you tell me or what you called me, because that's our brain protects for the physical pain, but does not protect for verbal pain. And I think what I'm seeing is with social media, with all these different avenues in that social media. I'm not saying it's a bad, evil thing, but it can be used where it becomes it's not helpful, it becomes hurtful to us, and all the causes that we're diabetic and trying to get the education out, and mental health and get the education out, it becomes it backfires on us because people are using it to make fun of, and it hurts people.
That's a great point, Buster, or I'm sorry, Paul, I see you nodding along. I hear you agreeing as well. Maybe you have some tips and tools for people living with diabetes through your own experience, Paul, to help the folks around them better understand and not be so harmful with the words, or what can you share in response to Buster?
Yeah, I think, and this was brought to me by a group of, and Erin and I had a lot of common work experiences working with children with diabetes in camps.
Yes.
And at a winter camp, this is a long time ago, this was teenagers, 12, young teens to 16. And the kids that evening, we were talking up by the campfire, and they said to me, we're angry that people call us diabetic. I said, this was 1977. Okay, this is a while ago. Still, the word labeling was wrong back then. And I said, okay, I have a sense, I think, but let me ask, what do you mean? And what they boiled it down to was, Paul, I'm a person who has diabetes, but I'm a brother first. That's more important. I'm a basketball player at my school first. That's more important to me. That's what I want to be known for. And they said, we don't mind that people say, gee, do you have diabetes? Or I learned that you developed diabetes. And they said what they resolved, and they said, we've got to teach other people about how we want them to be asking us the questions. And we are the professors of diabetes. The person who lives with it is the professor. And we have to teach them what's correct and what's okay. And I think from that, too, what I gained in my counseling practice, so often people would come to me, and they came because they were over-challenged. And I just say over-challenged at that time because we were going to work it out, and they were going to be the successful ones who developed their solutions. And because they were overwhelmed at the time, we would go step by step and go after to develop solutions so that they would find, okay, you've identified 3 things today that are messing up your balance of blood sugars, that makes you angry about yourself, all of that. And I would say, which of them do you think you could master at a higher level earlier? Which of those? So we look to build successes. And from that, I started to share with people, tell your friends, your family members about the successes you've had with diabetes. And I start to see this on social media now. When someone says, my blood sugars were normal for the last 24 hours, Yahoo. If you don't have diabetes, you often don't understand that's kind of challenging to do. Not so easy. And what people know about us that don't have diabetes is they know, oh boy, he had a tough low blood sugar 5 years ago. It always frightened me. It still does.
Yeah.
But tell them, I haven't had one since that day.
Yeah.
Remind them of that, because they remember kind of the negatives, right? In life, we remember the negatives too easily. So I stress the positive of how the balanced things you've done.
Yeah, that's great. And so, and we know that some of those lows can be very, very scary, and they're memorable for everybody. But we also know that we live day in and day out without those super challenging times, despite that we're working to keep ourselves alive every second of every day. And I love this part of the conversation where I can take this back to Buster. We've got a question in the audience asking, how do you balance teaching people about diabetes and or mental health, as it's not our responsibility necessarily to explain ourselves to others? Buster, I'd love to hear from you, from the mental health community, as I think it applies across, frankly, any population that's trying to explain themselves.
Yeah, so it's always hard to do that, right? Because lots of reasons. We're private people, maybe. We don't want to share a lot about ourselves, a lot about our background. But I always tell people that I work with, they may be out of a job for 4 or 5 years because they've had some type of mental health episode where they had to get treatment or in and out of the hospital, and now they're getting ready to go back to work, and they've got a 3, 4, 5, 7-year gap. And they're like, this is not it's not like if I took off work to be home with kids or raise kids or whatever. How do I tell them? Well, I always tell people, you just got to be honest, because we've got to start ending the stigma with our friends and family and in our workplace. So if a workplace doesn't hire you because you've got a medical or a mental health diagnosis, then that's a stigma. And it's also against the law, by the way.
Yes.
Just throw that in there. But I tell them, be honest, just explain to them, kind of like what Paul said, 5 years ago, this happened. It's not now.
Right.
And you can go into as much detail as you want, or a little detail, because really, quite frankly, it's none of their business.
Yeah.
But I think sometimes we have to share that, back in 2020, I developed COVID. I was in the hospital for over 40 days in intensive care, very serious, home on oxygen for 8 months. So I went through my own depression and anxiety and having to monitor for, diabetes and all these things, because my whole body was changing. Yeah. And I didn't know why or how. And I remember when I came back to work, I just couldn't climb these stairs that we have. And people would be like, oh, come on, you're not old. You can. And I was like, it has nothing to be old. Yeah. I said, I just spent the last, month and a half in intensive care. Okay. And I immediately get this response of like, oh, I didn't know. Well, again, you made an assumption on me because I was either overweight or out of shape or whatever. And it had nothing to do with it. Because before I got COVID, I was running 3 miles a day every day. It was the zap that this physical illness did to me. People with diabetes often feel like this is a threat to their, not just their health, but their everyday life, because you've got to change everything. The way you eat. You can't come to my house and have a bunch of sweets and drive back home sometimes, because you may not make it home, I have people all the time that's like, I just want to go and have a old-fashioned banana pudding, because we're in the South, and it's like, well, you can't do that, right? Yeah. But they don't want to have to explain to everybody at the party why they're not eating their banana pudding.
So I'm going to take this moment as a learning opportunity. Paul, you might see where I'm going with this, but Buster, you mentioned people with diabetes shouldn't eat sweets. And there's a question talking about how do you deal with the misinformation that leads to stigma? I want to point out that Buster is a mental health professional and a great friend of ours. And Buster, I hope you appreciate what Paul is going to tell you about right now in terms of assuming what people with diabetes can and can't do.
No, what I meant with that, I understand that. What I meant with that is this is what people always ask.
Yeah.
Yeah, you're right.
You're there,
yeah.
Being a diabetic educator, I understand. But,
right.
Yeah. So I fought for legislation years ago to make diabetic legislation in all of our senior centers, and they pay the senior citizen centers to do this diabetic education. But this is one of the things you get asked all the time, because you come into a party, you don't want to eat it, and then you're being judged and stigma that, oh my gosh, you're not eating it because,
Yeah.
So this comes from a place of experience then, Buster. Yeah. Thank you so much for that. I didn't mean to call you out. It was such a unique live opportunity.
Hey, you can call me out. It's okay. You can correct me anytime you want to. I'm human.
So Paul,
That's
tell
great.
us a little bit about that and, how you might respond in a situation like that. We want to point out, of course, that there are many different types of diabetes and they're each managed differently. Even within your type 1, type 2, gestational diabetes, every person manages themselves differently. And they should be allowed to. It's your body and your life. So Paul,
Yeah.
talk to me about people, even within the diabetes community, impressing that stigma and that judgment.
Yeah. So, and food is a huge issue, and we're kind of the conversations are revolving around food items right now, as it should. And it's a balance. 20, and I often say it's a balance, 25 hours a day. And what do I mean by that? I mean, it's obviously a 24-hour day. But even when you make even if you've been taught well, you have the great professionals who you've learned it well, you have very balanced diabetes, and you go out to dinner. And I was surprised a few nights ago, went out to dinner. I do very well with my blood sugar balance at this point, much of the time. I didn't say all the time. There's no such thing with type 1 total perfection. But I was surprised. My blood sugar was in the 250s. I think, what did I miss there? And I could blame the restaurant. I could say, like some friends and I have done at different points in our life, oh, I can't believe they must have put more sugar in the dressing, or they must have done whatever. No, I got to own that.
Yeah.
I didn't ask them what was in that dressing on top of that salmon. I had a healthy meal, salmon and broccoli with a salad, oil and vinegar. But I should have asked, and I usually do ask when I'm at a new restaurant. I was excited because of COVID. I haven't seen a few of these friends for 3 years.
Yeah.
So my socialization skills were excited, and I just kind of blunted my asking one question. And often the poor waiter or waitress looks at me as if, and they say, well, you don't look like you're too fat. They say it that bluntly. And I think, yeah, okay. Yeah, thanks, man. I said, this is not, I'm going to tell you what it's about, but it doesn't matter. You're supposed to be serving me right now. Would you mind asking your cook? I'm anxious to enjoy what he or she have made. So I keep it positive, but I get firm at times with this. And I get firm at times with friends when they keep saying, oh, you should have that. I said, no, I don't need it right now. My blood sugar is a little elevated. Or then they see me having something sweet, and this happens to all of us with diabetes if we have a hypo. So should you be eating that?
Yeah.
For goodness sakes, then glucose, then sugar is a medicine for us. I
Right.
better eat it, So I'd say to people, try to stay firm so you don't yield if you feel you shouldn't. But try to stay as positive as you can. If you have some dry humor, not sarcasm, if you have some dry humor that you can throw into it to help them chuckle a little bit, that might help the teachable moment. I don't know.
Yeah.
But you forever have to consider, do I need to bring this up? And Basti, you said something earlier. It's up to them, the person with diabetes, whether or not they want to share it. And people with diabetes have to remember that it's always up to us whether or not we choose to share. I want to encourage you to share because we need more professors of diabetes, so more of the general population understands it better.
Great.
My
Thanks,
mother-in-law
Paul.
has diabetes, and sometimes we get a phone call from her, and it's like, oh, she's not making any sense on the phone, So I know right where we're headed. So it's kind of like we had to jump in the car and get over to her house sometimes, and we had a really bad ice storm a couple of years ago, and we couldn't get out of the house, and she kept calling us, and obviously, she was just, if you didn't know better, you'd think, man, she's got schizophrenia or something, because she's not talking right. It's like, what is going on here? And we called the fire department, and they got out there and they gave her some D50 and got her back to, and then she called me and she said, why did you do that? And I said, why did I do what? She goes, why did you send the fire department over here? She said, I had 8 guys in the house and I didn't even know what was going on. I said, that was why I did it, because you didn't know what was going on. She had let her sister, her numbers get so low. And so we were talking about this, and I said, I said, we really need to educate the whole family what's going on, because she had also called her sisters, and they thought she was drunk,
Oh, dear.
and she doesn't drink.
Shucks.
Wow. Yeah. There are
But
so
it's
many
that-
challenges, right?
Yeah, yeah.
Just
And this is kind of early on when she was, we're trying to get everything. She just got diagnosed, and we're trying to, figure all these out. And the doctors were giving her all these lists of foods to not eat and to eat, and it's like, oh my gosh, this is worse than having some other, disease. It's like,
It is. It is. And everybody, every disease that everybody has is their own journey, and it can be super challenging. I've got a comment from Kelly saying, I love the term blood sugar balance, Paul. It's so much better than control. Yes, Buster mentioned earlier, Buster or Paul, one of you fine, smart gentlemen, mentioned that words matter. And this is no different in diabetes. And we have a lot of talk about food. Buster, you just mentioned that when your mother-in-law was diagnosed, that there was a series of foods that she could and could not eat. We've talked a little bit about what decisions everyone can make on their own. Paul, you mentioned family members, likely well-meaning, saying, should you, can you eat that? This can lead to challenges and eating disorders, particularly in the type 1 community. Buster, tell me any of your experience. I see you nodding along with that.
But yeah, so here's the thing. So last week, as any good presenter would do, I turned to our friend Google, and I started Googling just different things, and just about everything I found had to talk about the food you eat, don't eat, monitor your alcohol, monitor your diet. So this is a big thing, right? This is around the food. And then I got to looking at just some of the stuff that I have in the office that I work with people with. And again, diet was this common theme. And I got to talking, I went through some of my patient records, and I found where I had 4 or 5 that has diabetes. And so I called them and started talking to them and just kind of prepping myself for today. And I said, tell me about your situation. Tell me about your diets. Tell me about what the doctor said. And 2 of the ladies I talked to, actually, through our talking, had more of a food, a problem with not wanting to eat, and therefore they're underweight. They're having malnutrition problems now with their bones and stuff because they're not wanting to eat, because they don't want to set their numbers off. And I said, have you talked to your medical doctor about this? She goes, yeah, I have, but they see it's a mental problem.
Yeah.
And I was like, yeah, but haven't we talked about that in my office? And again, it was that they were afraid to share that there's some eating disorder going on, whether it's a diagnosable or not. They were modifying their eating disorder because of this fear.
Right.
And it is a big deal.
It is such a shame. And Buster, I know that NAMI has lots and lots of resources for people who are struggling or know someone who is with an eating disorder or any other mental or emotional health challenge. Can you share where people might call or visit for some of those resources?
Sure.
So just about every state has a NAMI, state organization or state office, whatever you want to call it. So you can call your local NAMI, and they can help you. Or you can go to the NAMI national website, and it's got tons of information on everything under the sun, right?
Right.
If it's a mental health, if we've been working on it, or legislation or whatever, it's all there. And all that's free to download and to use, using your trainings, using your education, whatever you wanted to use it for. But your local offices, oftentimes they have support groups, and these support groups encompass even people with diabetes for depression or anxiety. And some of them have groups that specialize in like eating disorders or different things like that. So.
Thank you. Paul.
Yeah, I think other resources, there's some really nice, and I like things that are written simply.
Yes.
I like that because even if you've got a genius IQ, when things are written simply, there's less of an opportunity to misunderstand or confusion. And it also, when it's done simply and concisely, how much time do we have to read all these things that get in front of us with electronic media? But groups like the NIDDK, NIH have some marvelous things on food, on exercise, written by some of the brightest MDs, nurses, dietitians in the world that are available. The American Diabetes Association has some great information that you and I, people living with diabetes, can access. Get on their web pages. And if web pages are something you're not that comfortable with, I know I'm a young 71, but I'm not that comfortable on the web pages sometimes. So I asked my two nephews, and they find out things on the web page for me at about 50% shorter time than it would take me to find something like that. Okay. And I'm proud of that. I'm proud they're so talented, and I'm proud that, and blessed that I have them to support me. And again, go back to your network. Who could be helpful to you when you go out to eat? And I see one of the messages. I see someone saying, I wear a CGM and it beeps off, so everybody knows something's happening with my diabetes. I wear a CGM. I would recommend people that if you're not wearing a continuous glucose monitor, a CGM, that you should at least be addressing this with your diabetes medical team. Okay. You and they will make that decision, not Paul Madden, who you just met on a Zoom call. Okay.
Yeah.
But bring it up to them. And in the beginning, often people tell me, oh, Paul, I understand. I see what's happening. My blood sugar is over 24 hours a day, and it lasts for either 10 days or 2 weeks, each one of these tiny little sensors that just quickly applies to your arm. But I remind people, remember, wait a few weeks, see all the data that you get. And as it suggests to you that, oh, gee, after lunch, I seem to be having a harder time balancing my diabetes. Does my medicine need to be adjusted? Do I need to try? Do I have the opportunity to go out and get a little walk in to help burn off some of that lunch? Whatever it might be, you and your medical team need to work that out. But I do think that, and I know it's annoying when it goes off in front of people and they sometimes even get frightened. What's that? What's the problem? Are you okay? And people who don't know me try that with me, and it doesn't work very well. I said, do I look okay? Life is good. Now, do you want to ask me a question about what that alarm meant?
Yeah.
And again, I try to become the professor. And the teenagers I worked with years ago were the ones who got me, the young adult professional, more confident in how I displayed my own life with diabetes. I'm thankful to them. And in a sense, they were my therapists. And your friends can somewhat be, they're not a professional therapist. I get that. And sometimes, by the way, it's okay to say, I need some help from a professional. That's a sign of strength when you can look at yourself and say, you know what, I want to make this better, this diabetes management better, but I'm not mastering it at a high enough level. Yeah. I need some help. It is a sign of strength to ask for help.
It is. And I realize we're a couple of minutes over what we initially intended. Buster, Paul, if you have some extra time to spend with us, we have some questions in the queue. If not, we completely understand, but we will hang on here a little bit longer. Buster, before we do that, I'd like to give you the chance for the final word after Paul on saying that asking for help is a sign of strength and your experience with that in the mental health community, because we know it is so true in diabetes.
Yeah, mental health for all. Mental health does not know a political party, and I'll use me and Paul, it doesn't know a northerner from a southerner. Only by our accent do we know that we're not in the same state. But I think that when it gets right down to it, it's okay not to be okay.
Yeah.
You just have to be willing to reach out and get the help that you need. Find the mental health provider that understands medical conditions, that understands diabetes. And if you're seeing a mental health provider that doesn't understand diabetes, get them educated. Because obviously we can't be educated in everything, right? We got to learn. We got to be. Paul said it. We become the professor, and we educate. And sometimes what I've learned is when a patient comes in to see me and they have a particular medical condition that I may know a little bit about by the name, but not
Mhm.
understand it, and they start telling me about it, it's like, oh, I did not know that, or let me make this accommodation because I didn't realize that, this would need to be changed in my office or whatever it is, right? So,
Right.
but I think what happens is eh, we we truck along here with this diagnosis of the big D,
Mhm.
and then we get diabetic stress and diabetic burnout, and we don't recognize it, and we don't get help for it, and then we start neglecting. Maybe we're not taking the readings like we're supposed to, or doing whatever the protocol is that the doctor wants us to do, or we don't, we start making unhealthy choices,
Mhm.
whether that be in food or lifestyle or whatever. And then the depression sets in and anxiety sets in, uh, and then we're more trips to the ER or the urgent care, and then it's this vicious cycle. And I often tell my patients it's a crazy cycle, right? Because we get in this loop and it just gets crazy on what we're dealing with, and we're not willing to just go, stop. I need help.
That's a great, great words, and really appreciate your experience on that, Buster. Thank you so much to both of you. I'm going to give you the opportunity to jump off the call right now if you have to, no
Fine,
problem.
fine, yeah.
We are so grateful for all of your time. Really grateful for all of you joining us. We're going to stay on until 2 o'clock Eastern. Do want to give a call out to Kelly, who commented, positive note, I'm in a theatrical production and I wear a tandem pump and Dexcom. I told my director that I can't take my pump off for 2 hours. So she said that my character has T1D and we're working it into the show. What a great way to
Awesome.
take your experience and educate. Heck yeah, Kelly. Send us an email at info@diabetespack.org with your production information, and we'll get in touch with you about that. We would love to be able to share it with our community.
Absolutely.
Got a couple of other questions in here. Any advice on telling new people about diabetes and mental health conditions, either in professional or dating situations? I'm guessing this is new people in your life as a person with diabetes.
Mhm.
Paul, I'm going to ask you on your many years of experience living
Yeah.
with diabetes.
Yeah. Yeah, so I think it's a great question, and it's a relevant question for everyone, especially in those early years with diabetes, as you're meeting new people and all. I think it's wonderful if you decide to become that professor of diabetes, and I tend to do it, and some of my other patients have taught me how to do this better. But I tend to do it when we're having, you go to the ice cream shop or you go to a restaurant or food is in front of us and I'll taste something, say, oh man, that's sweet. And then I look up and say, I could have this, but right now I choose not to because my blood sugar is not low and I don't need this. And it's wonderful that I can often figure out. And then I go even the step of, have you ever read the back of a package of crackers or cookies to see what's in it? And I remind people that, and this is what my mother did with me, for goodness sakes, when I was 8 years old. And she would say, Paul, with you having diabetes, we're going to help the whole family to eat healthier. The person with diabetes is encouraged to eat healthy foods, okay? Not too much of any healthy food. If you have too much of anything, it's not good for you, okay? So let's not go to extremes, but a balance of foods. And yes, carbohydrates are things we have to be more careful to understand so we can make changes with exercise and or medicines. That's true, very true. And that's some of the learning we have to undertake. But to go after it, I remind people that what's prescribed for me is a healthier lifestyle, to get more steps in. Everyone in the United States and the world is being told they should be getting more steps in, unless they're a marathoner already. Everyone is being told to eat healthier, unless they already are in that about 15% of average populations that eat very healthy. So I just say the norm is now to have less sugar, eat healthier, move more, and a person with diabetes is just told that a little more frequently than
Right.
what you're hearing.
Maybe in a different setting.
Yeah.
And you talk about all of the things and the healthy lifestyles and such. And we have a question from Catherine asking, do any of the panel see patients with problems with overexercise, exercising too much to the point of having to exercise to manage blood sugars, more of an overexcessive way to manage the mental drain of type 1, but actually having the opposite effect? And this might translate, I think excessive anything often translate into something other than a real love for what you're doing. And Buster, I'm going to look to you for that one. Comments on excessive or over excessive exercise.
You know, it's kind of like runners. They call it the runner high. You know, they have to run in order to feel good. And when they don't run, they're crashing. They're depressed. You know, and I there was a point when I was feel that, right, when I was back when I was running, and I one day I was running, and all of a sudden I just became like giddy happy. You know, it's like, what in the world is wrong with me? Well, it's because after that about mile and a half, everything kicked in, and it was like, this is your happy spot. This is what you're doing. But then it became almost like a poison to me, because if it was storming outside and I couldn't get outside to go run, then I was crashing and depression was setting in, or anxiety. Or I remember one day my wife was like, what is wrong with you? You know, because I'm in there like a big grizzly bear. And it was like, it was because I couldn't get that. I became so obsessed with the fact of running, not for health reasons, not because, you know, it was keeping me in, you know, my weight down a little bit or whatever. It was because my brain told me that I needed to do this, and I need to do it a lot, because it was taking the place of the normal brain chemistry changing up there and firing and all the little things that happens in our brains to make us feel happy, whatever. Same way with anything else. You know, you can do too much yoga, you can do too much whatever, because it becomes a substitute, and we self-medicate with those things. And I think we have to be very careful when we do those, so that way we're not self-medicating, but we're doing the right amount for what our body needs, or whatever the goal we have. And there is a goal. When I started running, there was a goal to lose weight, kind of, you know, stay in health, be able to breathe better. And then it became excessive to where it was not healthy for me. And I think that's where, you know, to the person asked the question, it does become excessive sometimes, and you have to be aware of that. And if you're, you know, if you start getting mad because you can't go and do whatever that activity is, or you know, you can't do it for 3 days because of an injury or whatever, and you're boiling hot, we probably need to look at that and say, okay, I need to step back and figure this out. Why am I feeling this way? Because it's no longer, it's counterproductive. It's no longer doing what it's supposed to do.
Because the phrase "too much of a good thing is still too much" comes to mind in that instance, and I think that sounds very relevant here. So, you know, you talk about the people with diabetes and people who may be exercising too much, and there's a lot of conversation about balance and imbalance. And so why do studies think there's a link between depression and anxiety with diabetes? I feel like I've been ping-ponging all over this conversation with things that we should always and never be doing, and what we're told and what we're capable of answering on our own. Paul, why do studies think there's a link between depression and anxiety with diabetes?
Well, I think clearly because you've got something you didn't want, you got something that makes life more challenging, more difficult. And so anything that, you know, we have this kind of false image, marketing 101, you know, we want to be Superwoman or Superman. And there is some of that gets fed to us in movies and TV and comments people make, all of that. And as we compete, and there's no question, it's frustrating, because unbalanced diabetes and learning your diabetes, or even when you know it well, things go off track at times. So it it disrupts a more steady life.
Mhm.
And that is absolutely the response that human beings have to that, and many animals do too, is anxiousness, depression, pull back, don't go after it. But again, I go back to, if you have appropriate supports in your life, and you have to call upon them sometimes, then you can decide, I'm going to learn to master that at a higher level, so it doesn't get me to pull back. So I do learn more about it to become a marathoner. Let me go back to the extreme exercise thing.
Mhm.
I used to coach marathoners who happened to have diabetes. And a couple of the triathletes were campers of mine, and one of them runs an incredible program for triathletes with diabetes. It's not what I want to do. I don't think what they do is excessive. It is for me, but it's not for them, because they've learned to balance their lives appropriately with their family, with their businesses,
Mhm.
and with their lifestyle. It's all about gaining a new level of balance when you go after things in life, if you are able to. If you're not, then I think you have to look at it again.
Yeah, and I think some of that balance relies on all the decision making that people with chronic conditions like diabetes have to do. We have a question saying, we very much relate to posts on decision making. I make a zillion of them a day. This is from a person with diabetes. It's exhausting. Agreed. Lately, this has led to decision paralysis. Any tips on getting unstuck and making a decision? Paul, I'm going to start with your experience, and Buster, ask for your professional expertise on this.
Yeah. It is overwhelming. And diabetes, decision-making paralysis happens to all of us, whether we know it or not, if you've had diabetes for a while. It's when we don't make a decision to ask about a meal plan, or we don't make a decision to check the blood sugar, or whatever it might be. And it's just normal. Take a break. What can you simplify in your life with diabetes, if you're able to? And if you can't get your hand on that, can't understand what that is, ask your son or your daughter, your partner, ask someone, a good friend, for a hug. I think there's not always clear answers for us in life.
Yeah.
And Aaron, you really were emphasizing so correctly. How many decisions do you have to make on a 24-hour basis with your diabetes?
Yeah.
It's multiple. And a few therapists who focus on diabetes have said 183 added decisions per 24 hours.
Yep.
The lowest I've seen, I think, in the last 2 or 3 years has been 101. But it's a lot. Every time food's in front of you.
Yeah.
Every time, how many steps are you going to take? How many steps did you take? Why are you hypo? Why is your blood sugar high? What happened? Why did this, it's a lot. So take a breath. You know what? Sometimes kick up your feet and put a good movie on. If that helps you relax, and you're not in any serious medical challenge and you're safe, just love yourself and relax for that hour or two and take a breath.
I think that's a great comment on caring for yourself and knowing yourself and what's important to you. Buster, I'd love to hear your comment.
Well, I think that, when you're looking at this big picture, we get to a point where we get into, some of the terms out there is like diabetic distress. And that is where when we start overloading ourselves with all these decisions and all these worries and all these concerns and what if, and then, like Paul said earlier, asking, even to the point where, what did the chef put in this?
Mhm.
You get to where you just don't want to deal with it anymore. And then isolation, depression, anxiety, all those things start setting in. And then when those set in, it's like, well, how do I deal with this? Well, I think in a lot of ways, you deal with the stress and anxiety the same way any other person would deal with it. Paul mentioned, hey, put your feet up, get that TV on, get your good book. Most Americans can't sit 5 minutes and relax. Yeah. So we have to train ourselves. We have to retrain our brain that it's okay to turn the TV on and put some stupid, crazy movie on that doesn't make any sense and has no real value to anything, and just watch it. I'm preaching to myself when I say that, because, I've always got some type of paper I'm reading or some journal I'm reading or research I'm trying to figure out, when I sit there. And, sometimes my daughter, she's 15, and she'll say, Dad, did you know I'm in the room? And I'm like, oh, yes, dear. I take the book and put it over, and I think sometimes we have to worry about, you know, because of the stress and the anxiety, we no longer are active. We got to get active.
Mhm.
We're no longer, taking the walk around the block with the dog or whatever. We no longer want to go out and stand at the mailbox and talk to the neighbors. Whatever. We don't want to do it because we become isolated. We're drawing inward instead of outward. And I know some people's going, well, I'm just an introvert, and that's not me. Okay, well, it may not be, but get active anyway. We got to figure that out, right? And then I think you got to find the right group of people to associate with. If it's toxic, chunk it. We don't need it.
Absolutely.
Great advice.
And I think sometimes we think we got to hang on to that relationship with whoever, family, friends, whatever, because we've been friends for 40 years. Okay, so they're toxic. They're dragging you down. They're causing you more health problems, and you just don't realize it yet.
Mhm.
Chunk it. It's okay.
If it's toxic, chuck it. Great advice.
Those calling or texting, those friends that you can reach out to when you feel that isolation, there's support for you. If you don't have friends to text, we probably need to find you some. There's groups, there's support groups. Your NAMI, Arkansas, sorry, but NAMIs around the country have support groups of all different things. And you say, well, I call, but they don't have one for people like me. Okay, then let's do this. Let's start one.
Mhm.
I don't know a NAMI out there that wouldn't be willing to sit and talk with you about how do we go about starting a support group of people that are dealing with what you're dealing with, if it's something different from what they already have. And then, I think, we've got to remember garbage in, garbage out.
Hmm.
If you're putting all that garbage in because you're either yourself beating yourself up or you're listening to other people's stigma or whatever, again, it's toxic. You got to stop it.
Mhm.
And we got to take care of ourselves. It's all about self-care, and whether that's doing yoga or doing meditation or whatever. Someone told me the other day, they said, I was speaking at this conference as a keynote, and I made a comment that, everybody knows how to meditate. So after I was walking down from the stage, and she says, I disagree with you. You may be the doctor, but I disagree with you. I don't know how to meditate, never meditated in my life. I said, let me ask you a question. When you lay in bed at night and you're laying there and you're thinking about all the bills that you haven't paid, or the problems that you got at work, or the problems in your marriage, or problems with your kids, what's that called? And she just looked at me and she said, what do you mean? And I said, it's called meditation, because you're meditating on all the negatives.
Mhm.
And she's like, well, I never considered that meditating. I said, well, that's what it is. Meditating isn't, so you don't have to put some incense in, and hum or whatever. It's the things you think upon.
Yeah.
So change the way you're thinking, and change it to be more positive, and all these things will start falling in place.
And I know that Buster and Paul would agree that this is all, of course, on the premise that if you are experiencing something that you can't address on your own, reach out for help. Reach out to NAMI, NAMI.org. Talk with your medical team, talk with your diabetes doctor, your favorite nurse, talk with your eye doctor. They are all folks who can help put you in touch with the right people. And I know that we had a comment in here about a diagnosis and then not really sure what to do after a diagnosis of depression. Always talk with your medical team. Anyone who is going to give you a diagnosis of depression should also be able to offer you assistance on what to do next. A diagnosis is a trauma. A diagnosis of diabetes is a trauma. A diagnosis of depression is a trauma. These are inflection points that need to be cared for and nurtured so that you can remain healthy and happy and safe. And that's what we want for you too.
And also, most of the NAMIs have referral lists. So if they live in a particular area, don't know, they can call their NAMI, and then normally they have providers have called in and put their name on a list. They can say, hey, you're 4 blocks from, Buster or whatever, So
Mhm.
And
I wish I was 4 blocks from Buster.
Yeah. And sometimes
You never
it's,
me.
sometimes we know it's hard to find the right professional. So there
Mhm.
has to be a good match. I've had diabetes 61 years. My first 2 superb docs with their medical teams have passed away at the young age of 84 and 77. So I'm on my 3rd doctor now. He just told me he's going to retire. And I'll be shopping again. And after my first doctor, I went to 4 different doctors before I settled on one that I figured, you know what? This physician is engaging with me. He's not afraid to ask me questions, and he listens to what my questions are. And he asks me to refine my questions, to ask them again a little differently if he doesn't quite understand. So we understand it sometimes is difficult. Not everyone who is a counselor that has the same counseling degree that I have is right for you. They just aren't. So there's got to be some of that match. I know in the smaller communities, there's not so many mental health specialists, not so many MDs. So sometimes it is more challenging. I wonder and think then that some of the expansion of telehealth could start to be helpful there, and I believe it already is being helpful there. So do your shopping, and if you have friends with diabetes or friends who have dealt with general depression, and you're able, give them a call and say, hey, are you comfortable with your therapist? You don't have to get into what you're going through if you choose not to, but just try to get referrals. We, the consumers, sometimes can recommend some very good people also.
Yeah, you're right about that. It doesn't, the reviews are not limited to restaurants and retail opportunities, right? Or the airport where you press the little button. It is so critically important to find the provider and the care team that works well for you, including the people that you surround yourself with in your community. And both Buster and Paul have been wonderful about talking to that point today. One of the things I do want to point out that NAMI also has and is wonderful about, not only helping people with a mental health condition, but helping their caregivers and caretakers.
Yes.
Because we living with a condition, be it diabetes or depression or anxiety, are facing things every day, there are still people who love us and are as concerned, if not more than we are. They need that support too. So I'd like to close on Buster and Paul, each of you just offering some words of wisdom on a support group. I personally would like to thank my whole family, my amazing friends, my incredible partner, without whom I wouldn't be here. So thanks to them and to you guys.
Yeah. Wonderful.
Yeah.
Hang in, stay steady as you can, and recruit good people around you. Stay away from toxic groups, relationships. I love that word because there are toxic groups and relationships out there. And people think they have all the answers for all of us. No one has all the answers for anyone in this world. But you and I have to develop our answers.
Yeah, just know it's okay not to be okay. At
Yes.
some point, we're all not okay, and it's okay to reach out for help. And the stigma ends with us. We start breaking the stigma in our own groups and associations. Like I said, mental health, diabetes, all these things, they don't know a political party. They don't know the North from the South. It's all of us in it together.
That's right, Buster, a beautiful ending. Thank you so much for your time today, for your extra time. I just want to encourage everybody to check out NAMI.org, N-A-M-I, it's the National Association of Mental Illness, right? And many chapters throughout the country, certainly many who are either local or state or county related. Please check them out. If you know someone who needs help, if you need help, give them a call. And definitely check with your providers on any medical question. You can check us out at DiabetesPAC, diabetespac.org. Follow us on the socials Jacob put on screen. Sign up to be an advocate. Buster, you have been the diabetes community's biggest advocate today, and we're so grateful. And Paul, we know that you do it every single day. You are amazing. For as many years as you've lived with diabetes so successfully, we aim to be you, man. So gentlemen, thank you so much. You can find this video on YouTube following today's event, and we hope to see you next time. Thank you.
Thanks, everyone. Stay
Yes.
well.
Bye.